Helplink Show, and it's November 2020. On this month's show, we are going to be talking with the CEO of Mental Health Reform, who are an organisation that lobbies and advocates for better mental health services within Ireland. They work constantly around submitting things for the budget every year and lobbying for change, as I mentioned. So we're going to talk to Fiona, the CEO from there, and we're going to learn a little bit about what has happened in the most recent budget, how it's going to affect us as consumers of mental health services and as clients, and basically, what is ahead for us the year now with this new budget that's come out. Although it is a bumper budget from previous years, an exceptional one, it's still going to have issues with it because of our already extensive waiting lists, for example, for public mental health services, both for children, young people, and adults. And COVID now has caused these waiting lists to be even longer. So how do we do that? How do we support people? And how do we, as a people, support each other with our mental health? Because anxiety and the stress of all this is affecting every single person in the country. And hopefully we'll learn a bit more about what's going to happen over the next year from that discussion with mental health reform. We're also then going to speak with the president of NUI Galway's student union and their vice president for welfare. And we're going to talk to them about basically student mental health in general, obviously more connected to the NUI Galway experience, but also in general about student mental health and what supports are out there. And most universities and colleges will have their own mental health systems in place, and the students' unions would be a huge part of that. So hope you'll find that very interesting, what's going on there. And that's about it. So we're going to go straight into it now, and we're going to chat with Fiona Coyle from Mental Health Reform. Thanks for listening, everybody. So welcome everybody to the Helplink Show. We have Fiona Coyle, who is the CEO of Mental Health Reform, with me today. Fiona, thank you so much for coming on.
Thank you for inviting me, Lachlan. Delighted to be here.
It's our pleasure. So we've had mental health reform on before. I think it was last year, and we were having a conversation at the time just about actually what mental health reform is. Would you mind, maybe we'll go over that a little bit again. What is Mental Health Reform? What is the organisation?
Yeah, no problem. So Mental Health Reform is the National Mental Health Coalition in Ireland. We're a membership-based organisation. We've nearly 80 members representing a diversity of interests. So we have members who deliver mental health services. We have members who work on children's rights, disability rights, members who represent, interest groups such as ethnic minorities. And what I suppose all our members have in common is that they're all committed to, Ireland delivering high quality mental health services. So we provide that platform for all these organizations to come together to agree on common messaging. And then we go out and we campaign on behalf of our membership on issues such as investment into mental health services, on reform that may be needed to various laws. We do a lot of policy analysis and innovation work as well. So yeah, we're kind of, I suppose we represent, the community and voluntary sector in key discussions with government and other key stakeholders such as the HSE.
Right. Okay. So for Joe Soap on the street, would they come across mental health reform in their daily lives? And if so, how would that work? I mean, you mentioned there about government and essentially lobbying government for better mental health care and that kind of thing. So that would be how they would see you, for Joe Public?
Yeah, I think so. Like, I suppose similar to other kind of sectoral representative groups, when you look at kind of maybe interest groups for, let's say, the vintners who have been in the news a lot recently, we would be similar, where we would speak out in the media. Maybe people have seen us quoted. We'd be called in front of Oireachtas committee meetings. So that would be maybe where they would see us. We're very active on social media as well. We have 23,000 followers on Twitter. So, we're active in those spaces and those conversations. So people may have come across us, but may not know exactly what we do. We are kind of providing that campaigning, that lobbying support for the sector, rather than delivering services, which is what many of our members are doing now at the moment, delivering key services to those who need them.
Yeah, I suppose, well, I mean, like you're mentioning nowadays, with everything that's going on, one of your remits would probably be to support those services in getting the funding that they need to keep their services going and improve them.
Yeah, most definitely. And, it's about, I think anyone I've spoken to has kind of said to me in terms of mental health has been really neglected over the years in Ireland. It's not really been prioritised politically. And I think our role and what we're trying to do on an ongoing basis is to show the importance of mental health to the people in Ireland, the importance of investing, and what a difference services can do to people. And particularly during COVID, since March this year, we've been living through a global health pandemic, and we have been kind of very vocal to say, that pandemic not only impacts our physical well-being, but also our mental health. And, we have seen, although data is still emerging, that there is an increase in those who are seeking support during the pandemic. As the longer the pandemic goes on, the more people we see that are kind of reaching out and looking for support, and our members are noting that as well. So it's about shining that spotlight on mental health.
Okay. Would anybody get confused? I know, because I'm like a caveat there. I am involved with mental health reform as a voluntary director in that. But before joining mental health reform and before really knowing that much about what was going on in the mental health space, I would have kind of go, okay, well, there's the Mental Health Commission, there's Mental Health Ireland, there's mental health reform. And to an outsider, I mean, there is distinct differences between all three. Maybe could you work with me a little bit about that?
Yeah, no, and it's a very great point you bring up, and I think it's one we reflect on the very similar names in all three organisations. So the Mental Health Commission is the regulator. So the Mental Health Commission is an organisation that has been established by law to regulate the services that are delivered in kind of institutions around Ireland. So you will see, they issue a report once a year where in the course of a year, they'll go into all the various institutions, and there's a set of criteria that they're supposed to be adhering to, and they'll report back and they'll raise, issues, in terms of, they're there to safeguard the rights of people who are accessing, our mental health services, in particular those more acute services. So they're kind of a particular body, a regulation body, so to speak. Similar to, we hear a lot about HICWA, so it would be the equivalent.
I was going to say,
yeah. So that so many people are familiar with HICWA, maybe not for the good reasons, but I think the Mental Health Commission play a very similar role. And then there's Mental Health Ireland. So Mental Health Ireland is one of our members, and Mental Health Ireland have branches around Ireland. So I believe there's one in Galway, and people may be familiar with them. So they, I suppose, offer kind of support and raise awareness of mental health in communities, and they're also really similar to mental health reform, they're very much trying to focus on the importance of the individual voice in any discussion around mental health. That recovery is possible, and that the person who is accessing the services, they have a voice, and services need to listen to the experiences of those who are accessing them, and they need to be reflective of them, and that it's it's co-produced going forward, I suppose, anything that we do. So and then I suppose we're kind of there as a kind of an oversight, a sectoral representation of voice.
Yes, I was going to say, so kind of from what I kind of gathered from that is like Mental Health Ireland are kind of more kind of say towards the individual orientated needs as a service user, supporting them, giving them information, that kind of stuff. Whereas Mental Health Reform is kind of, as you said, for the sector, for the organisations that are providing the services out there, you are a representative body for that.
Yeah, and I suppose, as Mental Health Reform as well, we do have, we want to make sure ourselves that those voices of those with lived experiences, the service users, but also the families and the carers are really important in all of this. So we have a grassroots forum in mental health where our members nominate people into that forum. And then anything that we're doing, any new policies, we would seek their input and their guidance on it. And, a number of individuals sit on our board as well from that forum. So, equally, we're driven to represent the needs, the voices of our members, but also equally the voices of those people who have the lived experience. That's why important. We're here. It's the most important voice, I think, in all of this.
Yeah, and so every year you would also have what's called pre-budget submissions that you would give into government to say, we believe, our members and ourselves believe that this is what is needed going forward, money-wise, from the budget. To provide a top tier mental health services across Ireland. Now, every year, maybe not this year, but we'll talk about that in a second. But every year, for a very, very long time, unfortunately, they have not invested in the mental health sector to an appropriate amount. I think somebody gave me some figures before that there was more investment in the 1980s than there is now in the mental health sector. So every year, then you guys will bring a budget together, say to the government, this is what we believe needs to be done within the budget to provide these services. Am I right in that? Is that how it works?
Yeah, no, that's completely right. Like what we try and do is, we do our homework and we analyze, what are the gaps, like what it's going to fill, what's going to cost to fill those gaps, and we try and be pragmatic as well when we do this. Like we're not asking for, huge amounts of money. We're looking for, I suppose, in the overall scheme of budgets, a relatively small increase in what we would believe would lead to transformational changes for people's lives. So yeah, every year we make a submission. We meet with ministers, we meet with various TDs across the political spectrum, and we ask them, first of all, to prioritise mental health because, unfortunately, as can be seen in previous budgets, it hasn't been prioritised in those discussions. And we also launch a public campaign where, we ask, this year we asked members of the public to contact their TDs, and, we had nearly over 2,000 emails that went to various TDs across the country. So, thank you anyone listening who was one of those people who sent an email or rang their TD. So we try and generate noise because, as you know, politicians, they listen to what's popular and they want to show support to what their constituents want them to focus on.
Yes.
So the more that we can show that And then on our budget submission, we can show, the numbers. We can make the economic case as well, which is really important. Because in budgets, the Department of Finance is very interested to why are we investing here? And we try and say to them, look, this is an investment. If you invest now, you're going to be saving money because you're investing in services and supporting people who may need support at a particular point. But if they've put on a list and they don't get that support, that person is going to need much more support and is going to cost much more to the country and to their community and to their family as well. So we try and kind of come at it from all angles and use any means and tools that we can to try and make people aware that this is something that there should be investment in.
Because it's unfortunately throughout our health service, actually, it's more of well, to my view anyway, it's more of a firefighting exercise rather than fire prevention. If to put it in another way, so if you maybe if you invest in more fire engines and more fire officers, you won't have as many fires. And if you invest in education of people about, for example, smoking in their homes and this kind of stuff, you can start to reduce the amount of house fires. So that makes logical sense. But within a yearly budget for a government, it's very hard for an accountant, let's say, to say, well, we can only really concentrate on the next 12 months kind of thing, So it must be a very, very hard job for you guys, and I have to say, hats off to you for doing that every year. This year now has been an exception. The budget in general has been an exception to pretty much across the board. So what's happened this year from a budget perspective when it comes to mental health?
Yeah, so this year, I suppose, maybe to bring us back on the journey mental health has taken and how we got to budget, because it's been a fight, and kind of want to illustrate that COVID, over the course of the various phases of the COVID pandemic, we've heard, really great words of support around mental health by various leaders, past and former Taoiseach, for example. And we've been really taught that, there's a really strong case for investment, and we were working very hard to get COVID into the winter, or get mental health into the winter plan. And when the winter plan came out, there wasn't a penny going towards mental health services in it. So, we expressed our disappointment at that. And then, we
and
see.
Was there a response back to that? Sorry for interrupting, but was there a response back to that?
There wasn't. I suppose when we raised it, and we weren't alone in raising it, people across the country were saying, someone said to me, if I need to go into a hospital bed because of my mental health difficulties, am I less important than someone, who has to go in due to physical health difficulties? And, it wasn't, it was something that we were very disappointed in. Some of the services we have been told, especially at primary GP level, can't help support, they're not distinguishing between mental and physical health. So the GP supports can help, but, specific supports where needed. And then we kind of, after that, we heard, our Taoiseach and our Taoiseach came out with very strong words around how mental health was at the heart of their policy-making decision processes. So, we were
it's like a double optimistic.
Message. So we were optimistic before, but then we got the actual money. Show me the money, they say. Words are important, and we welcome words, but the money is what we were after. Then budget day came, and we were. I think the allocation is an additional 50 million.
Right
now, when that's broken down, there is 15 million specific for COVID responses, COVID specific mental health initiatives. We have then 23 million for new developments. We had a new mental health policy launched earlier this year. So that 23 million is to be aligned with that policy, which we welcome, and it's something we asked for. And then we have 12 million for existing levels of services. So year on year, like everything, our own household bills get expensive year on year. It gets more expensive to deliver mental health services. So even the basic service that we're being provided this year will cost the state more next year due to inflation and other factors, staffing costs rising and things like that. So we welcome that. But we had asked for, specifically with existing levels of service, we'd asked for 30 million. So we would be concerned, is 12 going to be enough? And there is this 38 million for new developments, the COVID and the sharing the vision. Yes. Like we need that to be ring fenced. That needs to be separate. Yeah. And we've seen in the past that money that has been promised has kind of been siphoned off to cover existing holes that are there. So we're very happy, and we think it's a really positive first step. But we need to hold the government accountable into the weeks and months ahead to make sure that this money is spent how they said it will be on budget day last October.
Yeah, it is. Look, without a doubt, it's great to see the investment within the current budget that's going out. My worry, and I presume was partially your worry as well, was because of all these lockdowns. A lot of the services like CAMHS, for everybody out there, children, adolescent mental health services, and the other inpatient services and that kind of thing. These waiting lists they were already terrible, and they're skyrocketing now. So did that formulate part of your submission, and were you happy with the response to that then?
Yeah, I think, that's one of the bottlenecks in Irish mental health system is waiting lists. And waiting lists are there. Mental health services, they're primarily human resources. Like people might, people need to go into maybe talk therapy, or may need to go to see a psychologist or another kind of health professional to assist. So the problem comes down to staffing. And we know in kind of community health teams, community mental health teams around the country, that some of them are only at maybe 60% staffing levels. Our staffing, one of the really kind of interesting facts that has kind of come up is that our staffing levels in the HSC in the HSC now are equivalent to the number we have working there, equivalent to the number that is less than what was there in 2016. So we have less staff now than there was previously. I think it's 2016. It might be a bit earlier, but around that recession time. But it's the level is less. So we haven't. The country did go through a big economic recession in the middle of the noughties, and staffing was reduced, investment was reduced, but we're not back there, and we're heading into yet another economic recession. We're there already, and the mental health needs are increasing. So we need to prioritize staffing and ensuring that people are being recruited and retained, and that those posts are in place. And this isn't just a challenge, I suppose, for mental health. It's a challenge across our health care system, but we do have an opportunity to address it. Like COVID is, it's one of the most challenging things to have ever happened to us as a country, but there's also huge opportunities there. We don't want to go back to how things were. That wasn't good enough for so many individuals and so many families around Ireland who couldn't access services when they needed them. We need to think, using this focus that we have now on our health system to break down some of those bottlenecks and to work towards, a mental health service that meets the needs of everyone, no matter where they are in the country.
Yeah, exactly. Wow. Okay, a lot to digest there. Is there anything coming up from a mental health reform aspect that you'd like the listeners to know about that they can get involved with, maybe, or anything like that?
Yeah, so I'd recommend people, if they're interested, in making their voice heard now or into the future, follow us on social media. Our website is www.mentalhealthreform.ie, and, sign up to our newsletter. We'll be kind of putting out our analysis of the budget and in the coming weeks. We're also going to be, out there very loudly asking for mental health to remain a key focus in any COVID recovery plans. Long after the virus will leave these aisles, the impact that is left behind on people, on communities around Ireland is going to be felt, and we need to start preparing now for those future demands. So just follow us and make your voice heard if you agree with what I've been saying today.
Yeah, and the same, I suppose, goes with any mental health organizations, NGOs, that kind of thing, that are out there that haven't gotten involved in mental health reform yet, to get in contact with you guys and become and make the voice stronger for the organizations in the country as well.
Yeah.
Okay, cool. Thank you so much. I really appreciate your time, Fiona, and thank you for all the work that you guys do in mental health reform at the forefront there of making change within the country. I really appreciate everything you do. We might get you on again in a few months' time to talk about the sharing the vision piece, because that was something that was changed recently, and that's basically kind of the roadmap to what we want our mental health services to be like in Ireland, and hopefully the HSE and the government are to use that roadmap going forward. And as far as I'm aware of mental health reform, is once again you kind of are oversighting that and making sure that they're keeping to what they say they're going to do.
Yeah, that's our role. Ensuring that our government is accountable for their promises. So will be a pleasure to come back. Thanks so much.
Excellent.
Lachlan.
Thank you, Fiona. So everybody, that was Fiona from the CEO of Mental Health Reform, and as she said, there are lots of information on their website, which is www.mentalhealthreform.ie, and all the links to their social media platforms are there as well. So do get in touch with them, do follow their social media, and keep yourself abreast of what's going on. And so that is it for now. And next we are going to have NUI Galway's Students' Union Society are going to be talking to us. Their welfare officer and the president of the Students' Union are going to be talking to us about the challenges of mental health for students with the students, and also about the charity initiatives that got going this year. So we'll be back and talking to you in a minute. Welcome everybody to the Helplink Show. We are back, and we have today, we're going to have a conversation with representatives from NUI Galway's Student Union. We have Pádraig Toomey, who is the president of the Students' Union, and then we have Roisin McLaughlin, who is the welfare officer. Have I got that right, everybody?
Yep.
Yeah, cool, great. First time having you guys on. We do a lot of work with NUIG. We actually produce the show in normal times in Flirt FM studio in NUI Galway. And we actually do a lot of work with NUIG students over the years and every year. And one of the things that's always kind of been an underlying thing that we've seen is that student mental health and youth mental health in general is becoming more and more prevalent, that we need to have more and more services for young people and students in general. Maybe I'll just talk to Pádraig first off. Pádraig, can you tell me a little bit about the Students' Union and your role within that? How does that all work?
So yeah, we're a large body. We represent nearly 19,000 students. So it was set up by Michael D. Higgins himself a long time ago. But the whole purpose of the union is just to protect students, to do everything we can to help them in whatever way that is. If it's welfare, if it's equality, if it's if it's just any issue that they can think of, just as because we want to represent them and protect them at all levels of society.
Right. So would you be working with the general authorities within NUIG themselves on a continuous basis? Is that kind of your representative body, really?
Yeah, so it's we're kind of like a trade union plus. So we represent students on committees throughout the university. We all sit on dozens of them each, and just to kind of get the student voice there and to be their representation. But then we also run campaigns, and we just do fun things, and we run commercial services on campus like Salt or Smokies and stuff too. So we really are just we try to do as much as possible for students.
Yeah, that is a lot to take on, and there is core staff that are there all the time, but then the upper management, let's say, of it, like yourselves, does that change every year, or is it a few years, or how does that work?
Yeah, so there is an election every year, and people can rerun. Obviously, no one has rerun in a while though. And then so you have your 3 full-time officers, myself, the president, and the 2 vice president roles, welfare, equality, and education. And they run for election along with the 15 part-time officers too. So they're just on different weeks. But so we have a team of 18 officers that range from every issue, from LGBT to disability to just conveners of the different colleges as well. So just a bit of everything.
Yeah. And every year now, one of the reasons we've ulterior motives, of course, there always is. One of the reasons that we're having you on today as well is that Helplink was lucky enough to be chosen, one of the 3 charities chosen this year for a lot of the charity work you do. What is this charity piece that you do?
So every year we pick a couple of charities to be our, that we fundraise for, rather than just kind of being all over the place. We decide on them at the start of the year. We decide on yourselves, Mental Health Link, Galway Rape Crisis Centre, and Galway Autism Partnership are the 3 we're picking this year. Yeah. And we're being extra creative this year too, because it's just because of the time. So we decided to launch the Charity Challenge. So it's 6 different challenges, 1 for each month, for the 3 charities. So then first month is going to be a kilometre challenge. So it's really about picking your own, what you think is a challenge. If it's you want to run an extra kilometre each day, or if you're going to do 200 kilometres in the month, or if you want to even if you're in a wheelchair, if you just are going to go outside for an extra 500 meters each day just to be outside. So it's really just about not just about the distance, but also getting out and just being a bit active given the times.
Yeah, exactly. And as you say, given the times, I mean, normally in a normal year, a lot of these events would happen on campus, in or around campus and that kind of thing. But now a lot of it's been done from people's own student digs or wherever they can get out and do bits and pieces like that. So the first one is about that. And then in December, you have another challenge coming up.
Yeah, so December we go to Random Acts of Kindness, really kind of into the Christmas theme. Yeah. And there'd be loads of little things that you could do, little challenges kind of of random acts of kindness you could take part in, and that you could even decide how many you're going to do. So it's again picking your own pace. Yeah. Each month we're going to have as many perks and kind of prizes as we can to kind of keep encouragement up. For the kilometre challenge, we're even going to be doing, let's say, 2 sessions a week of kind of a trainer who will just kind of motivate you and just give you a little bit of, if you want to do a little bit of exercise on Zoom. Brilliant. And just kind of bits like that. We're going to be sending out random prizes all the time to it. Well, if you do a challenge, you'll get a t-shirt, and if you do enough challenges, you'll get a hoodie. And if you want to do all of them, we'll give you a super prize, is what we're thinking. We haven't decided that just that yet. If you want to go above and beyond, and yeah, it's all in the hopes of raising money for charity.
Brilliant, because it's always been a strong element of charitable work from students, not only doing runs and these kind of things, but also volunteering as part of their time. And I might talk to Roisin about that in a second, but just to come back to the challenges then, so there'll be then January, February, March and April is the other 4 months then, and there'll be different challenges each month that people can get involved in, so that people don't have to do all 6. They can pick and choose and that kind of thing.
Like January, I'll be trying veganism for the first time. We'll see how that goes, because it's all about, that's to motivate you to your new you, new me kind of thing.
Yeah.
February, we're back on kilometer challenge. March is the mystery challenge.
Okay.
So, and then
that's not Cluedo. That's actually a mystery show.
it's a mystery. So keep it under wraps for now.
Okay.
So it's all a bit of fun. It's all for the right thing. Kind of. I think it'll just get people motivated, keep people, a chance to engage, and also make friends with a new group as well. That's
the thing as well, because I mean you've got all these first years there now as well, that have never there's completely alien environment to them, and some of them might have even moved from wherever they live to Galway to come here. A lot of them would have, and so it's there's the mental health aspect and mental well-being aspect of that, of creating friendships and from these things. And so you guys are doing the best you can within that. Roisin, student mental health, welfare, it's obviously a big thing, and as I mentioned at the start there, there's a lot of research coming out now that's showing that anxiety levels are actually they're rising and rising. They were rising even before COVID happened. So what was your experience of welfare, and why did you choose to go for the welfare remit, I suppose, within the Students' Union?
That's a really good question. I suppose I chose welfare because from being a student, I struggled a lot with mental health and finances and accommodation, basically the whole welfare side. And I just want the college experience to be as easy, like as good as possible as it can be for other students. Like if any student is struggling at all, like I came from Antrim to Galway, so like I didn't know anyone, and like the first while was like a bit lonely, but then like you get to know new people, make friends and everything like that. But just to kind of make sure that other students have a good time and they aren't struggling, and if they are struggling, they know that there's someone there to chat to. So I would like be very active on social media and promoting the union services, so that people know that there is someone there to support them.
So let's just imagine it's a normal year. For a welfare officer, I mean, presumably you plan out the year ahead and what's going to be coming within a normal year. What it sounds like is a lot of your work is signposting, but would you also be involved with creating events around different types of welfare? Presumably it's not just mental health welfare, it's actually physical welfare, all that combined.
Yeah, so a lot of my job is signposting and referring people on to the relevant services. But yeah, the welfare officer also takes the lead in organising things like SHAG Week, so Sexual Health Awareness and Guidance Week, things like Mental Health Week, Mental Health Mondays, like Drug Awareness Days, things like Seachtain na Gaeilge, all of those type of events. And we had a few events in the last few weeks. So we were doing things like weekly walks for new people to come. Like it was pods of 15 and people just came. We all wear a mask, we're all socially distanced, and they just came and like got their exercise in, but also got to make new friends at the same time, which was really nice, because a lot of them were international students that have came from all across the world, and they just don't know anyone, and they're stuck in their houses and with online college, which can't be good for anyone. Stuck looking at a screen all day. And then they all went and got lunch afterwards, which was really nice. And we had a comedy speed friending night last night. So like we do try to make as many events as possible for new people to make friends.
Yeah, that's a very, very important element of that is that, like you said, somebody to talk to, because it can be a very lonely experience. It's even more lonelier now. So with everything that's gone on, when you were coming into the job in September, you must be kind of going, oh, what have I done? What have I set myself up for here? So when you guys got together, and what was your thinking for this year ahead? I mean, have you added new things? I mean, have you had to obviously change a lot of things, but obviously COVID has become an extra concern. And you were mentioned there, you were doing bits and pieces around walks and that, but now with this lockdown coming in, presumably some of that stuff is being pushed back. So you constantly have to move what you're doing within the union.
Yeah, so we've had to become a lot more active on all social media platforms this year. So we got TikTok for new first years to try and engage young people. We're constantly trying to think, how are we going to like move this to online? How are we going to make it as enjoyable as it can be for people? So even last night with the new we had a comedian doing a comedy night, and it was also like a speed friending night. So, and people won prizes, so they'd be put into like breakout rooms and stuff to make friends. But even that, it was kind of like a trial run, because it was like the first time putting anything online. So it really is just like a kind of a trial run with everything, seeing how we can move this online.
Yeah, and that's a brilliant idea with the speed friend element. Because when I first heard that, I was like, speed dating? It's going online? No, it's actually speed friends you're actually doing. It's a fantastic idea, where at least it's not just like through social media. Social media is fine, but and it can be helpful, but the virtual face-to-face, at least then, whenever you guys do get back to campus, you'll be like, oh, I know that person. I was speed friendly with that person and that kind of thing. And it makes that transition hopefully a little bit easier to going back into the somewhat normal life, if we can get a vaccine going and that kind of thing. So the charities that you've chosen this year, what was the thinking around that? Besides ourselves, I know it's very obvious for ourselves, the mental health, but the Galway Autism Partnership and with the Galway Rape Crisis Centre. These are also, I know over the years there's been a lot of stuff going on within NUIG about protecting people when it comes to assault and that kind of thing. Was that part of the reason around with the Galway Rape Crisis Centre, for example?
So for our charities, how we pick them is it's a collective decision. We bring it to the executive, and we advocate for any charities that we know do well, and just try to pick from like so many charities that all deserve, you kind of wanted to pick them all is the problem,
of course,
and you kind of feel bad when you're kind of trying to trim it down to put it down. So that's why these three charities came out at the end, and I think they were just very close to people's hearts on the executive. We just know that charities are very much underfunded this year. They didn't get their chance to have their fundraisers this year, with runs and any kind of gigs that they did use before are just completely wiped off. And we picked ones that are both relevant, that we feel like are in the city and local to us, and also just like that we feel like people really need.
Okay, great. The other thing, I suppose, around student mental health and student welfare is that a lot of the services that would normally be open are closed now. So how do you, from a welfare aspect, Roisin, how do you think the students are responding to this current situation? And because you were saying you're doing a lot of signposting, so. But unfortunately, some of the people that you can signpost them to are actually, their doors are closed now, or they have only a small online element and that kind of thing. Are you getting much of a sense of frustration from the students?
Yeah, I think online learning is tough for anyone to get used to. I think especially even lecturers, when they've been teaching for so many years, and it's a complete different thing. But for students, especially new students, they're not getting that experience that other years before them would have got. So there is a sense of frustration, but I think they're all getting through, telling themselves positive things. It'll be back to normal soon, next year, second semester. So things like the counselling service, it had to go completely online. And it was worrying. Some students would say they couldn't really do online sessions because they don't have a safe space at home, or privacy, or even like internet connection. So
Yes.
that's worrying. We actually saw in a government announcement a couple of days ago that Simon Harris has said that spaces should be made available on campus for like mental health services. So if a student wants to like get a private room on campus just one-on-one, hopefully it's something that NUIG can make happen, because it is something that I know the counselling service have been fighting for. Like, yeah, I don't know how students feel really about having things like counselling services and like health services through a screen. I mean, like I said, it's just a really different experience, and like nothing compares to like physical face-to-face interactions. But it's all still there. It's just operating online.
On a different level. Yeah, and but that is a great idea, and hopefully NUIG will help with that, to be able to create a space, because you're right, privacy is key to being able to express how you feel. And if you're constantly worried about somebody taking a shower next door or something like that, and even though you know they probably can't hear you, it's still in the back of your mind, you're still going to be less likely to say exactly how you feel about that. Is there any plans to maybe try and gauge the levels of anxiety or frustration for the students throughout the year, from the students' union aspect?
So we were involved with a COVID survey back in the previous SU was like last March when it kind of first happened, and that'll be there's plans for that to be relaunched there in the next month too, just to gauge how students are getting on and just kind of figure it out. So that's in partnership with the university. So and just to properly gauge each kind of where the issues are arising and how we can help.
Yeah, brilliant, because that's, I mean, like it's very hard to take the pulse of what's going on for people, like and surveys like that will be very helpful, and hopefully we'll keep you a little bit more time, because they will be at home the whole time. Is there are you hearing anything about how they're feeling about Christmas coming up and that kind of thing? I know that sometimes every year, presumably some students would stay actually on campus during the Christmas season. Is there more of a worry for that now, and just the lack of knowledge about what am I supposed to do? Should I go home? Should I stay? If I go home, do I have to quarantine for 2 weeks? And all that kind of stuff. Are you getting a lot of those kind of questions?
So we do have some students who are kind of in the more vulnerable groups, or also students who are just international students who won't be heading home, and like the whole the chaplaincy would have ran a great service each year just to kind of keep them, a community involved and have a good Christmas. There is going to be it's going to be different this year, and we're going to have to, I think we're really going to have to put our brains together to make sure that like they aren't forgotten about, and there is some kind of special Christmas for them as well, be it if hopefully restrictions go down, we're back to level 2 or something, and you can kind of organize a dinner between different groups and everything. I don't think it'll be as the same as previous years where you'll have the chaplaincy running a massive dinner there. So it'll be different, but hopefully we can still make it meaningful and special for them.
And as to your knowledge, like have the universities or the students' union been given any guidance as to what students are supposed to do on their breaks, not just Christmas and that kind of stuff, whether they're supposed to go home, whether they're supposed to stay, or what's the way they're saying to everybody, if you can work at home for the next 6 weeks at all kind of thing. Like, are they saying anything to students? Because obviously there's a massive amount of students moving around the country all the time during these breaks. So has there been any guidance for you guys around this?
We know that our institution, NUI Galway, did they recommend that you don't travel home at the weekends. They want wherever you do decide to stay, be it at home or back in or in Galway, to kind of stay there. They're kind of against us moving and traveling around. We think it's still up to the public health guidance on it. Like if you're commuting, you're still allowed. You're still allowed to go for educational purposes. So if you're coming into your labs, you're still allowed travel. So across county. So that doesn't even change in level 5 at the moment. So that it's kind of a weird one.
It's a strange one. I can only imagine that students are starting to worry about these things. About like, do I go home? And if I go home, will I stay there for 2 weeks? And all that kind of stuff. It's I suppose like everybody else in like every other area in life, we're all unfortunately a little bit clueless as to what to do right now, and we just have to go on the government advice and keep going that way. Yeah. Okay. So the next event you guys are doing is in the month of November, which we're going to be in, and that is the kilometre one. And hope if any students want to get involved, how do they find out more? Do they go to the website or social media, or how does that work? And what are those links?
Yeah, so if you go onto our SU website, there'll be the actual like if you look up NUI GSU Charity Challenge, it comes up there. You can there's a link to register, or there's a link to to see all the information. It goes through each month, and it has like the link to donate if you want to donate to us on GoFundMe. So like there's just options there to just read in what to do. It's a great way to get involved. Yeah. I can't sell it enough. I feel like
no, you're dead right, and it is. I've volunteered most of my life in different things and that kind of stuff, and there is such a great sense of well-being coming from doing something for somebody else, and all the research will show that as well, that if you're doing volunteering or doing charity and that kind of stuff, like it's not just about getting support out to people and getting funding out to organizations and that kind of thing. It's actually a bit of both, because it's actually an element of self-care to that. Thanks very much for that, Park. Roisin, is there anything that you want to say from a welfare aspect when it comes to the students over the next couple of months? Is there anything that, besides these challenges that are going to be coming up for charity, but for more of a self-care thing?
Just to tell everyone to mind themselves. Like, it's a really difficult year. We've all gotten this far through pandemic, so we're all doing great. Just like, I suppose, try to limit your screen time every day as well, because it does get a lot being on the screen all day. And try and go for a walk, try and get some exercise in. It really is good for the head. Also, like within the guidelines and everything, of course, like, have a good support network around you. Like, try and spend time or like talk to friends, even if it's on the phone or like from a distance. Like, try and talk to friends, try and talk to family, because talking does just help so much. And like, just know that like you have people around. I think the most important thing coming up to Christmas is to spend time with loved ones. I think it's especially this year, it's going to be a really different Christmas. So just make sure that you have a good network around you and you're taking care of yourself.
Brilliant. Thanks to you both, and to all the students listening out there and everybody else as well. There are helplines like the Samaritans and Pieta House, but there's also a new text service. The number is 50808, and you can text that if you are in crisis, or you can text that if you're looking for signposting support and that kind of thing as well. Pádraig and Roisin, thanks a million again. We really appreciate you coming on to the Helplink Show, and the best of luck to all the students that are going to be involved in the charity stuff. And thanks once again for choosing Helplink as one of the charities. We really appreciate it.
Thank you, Lachlan.
Okay, thanks.
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 Well, I hope you all enjoyed those conversations with Mental Health Reform and with NUI Galway's Students' Union. A lot of information there to go through, and hopefully we've cast a bit of a light onto the subject of mental health services from a national aspect, and also then from a student mental health aspect. Really appreciate you taking the time to listen to us, and very much appreciative of all the community radio stations that host our show. We really appreciate them taking care of us, especially during this time of COVID. Listen, Helplink Mental Health, the organisation that produces this show, we still have free counselling available for anybody that has had a job loss due to the COVID-19 situation. So if you want to get in contact with us, go to helplink.ie or call 0818 99 88 80. And we can help you out there with that 6 free counselling sessions, no matter where you are in the country. Also, our other counselling services are available 7 days a week as usual and out of hours. and they are general counselling, which is solution focused. Then there is bereavement counselling, addiction counselling, couples counselling, which is especially fraught at this time, and then we have play therapy and art therapy available in both Galway and Mayo offices, but the rest of those services are available nationally. So once again, thank you so much for listening, and we'll be back to you in December for the next show. And don't forget to keep your head up.